Welcome to the podcast, Kiran sir. I've been hearing about you since a lot of good time now. You have been in dentistry for 25 years now, and you are running 3 clinics now with 4 chairs in each clinic. I want to know, how was your 25 years of dentistry?
Thank you, Dr. Prathamesh, for calling me for this podcast. 25 years journey is really very informative. I learned a lot of things in this 25 years. Initially, I used to do consultant practice, orthodontic consultations. Then I used to go as a visiting faculty, and
Mm-hmm.
then we also have an doctor-based clinic that is a solo practice.
Okay.
Because my wife is a dentist, so we
Acha.
started a practice for my wife. Initially,
Okay.
it's my thought is for the practice.
Okay. Do
Yes,
you really think that dentists are making money now?
yes, definitely. How about buying a Rolls Royce from the dental practice?
Okay.
There's a clause for it. Only when you become a dentrepreneur, dentist becoming an entrepreneur, then it's possible to buy a Rolls Royce. There's a difference between a dentist and a dentrepreneur. A dentist know how to do a good dental practice, but a dentrepreneur can know how to do a good dental practice as well as how to market his practice. That's why managerial skills is more important to become a entrepreneur.
Okay.
In managerial skills, you have these four parts like marketing,
Okay.
how to do sales, how
Uh-huh.
to do operations, and how to do and financial aspects,
Okay.
and even the legal aspects. As you know, we have conducted FBD, that is a Forum for Better Dentistry conference.
Sir, to the people or to the dentist that doesn't know what is FBD, can you please explain what was FBD?
Yeah. Forum for Better Dentistry is a non-profitable organization which is started by a senior dentist to educate our peers and the youngsters who are coming into the practice to teach about the managerial skills. It's a 2 day workshop or a conference which we organized where the dental skills are not taught. It's only about the managerial skills. It's like marketing, internal marketing, external marketing, digital marketing, and soft skills, and so on for the 2 days.
Okay. Sir, in 2025, where there are a lot of clinics everywhere, do you think a dentist he has done now BDS? Do you think he should practice?
Yes, we are born to practice. After doing BDS, if you start a practice, you have so many advantages. Like you are the owner of the practice, so you have a flexible time, and you have that satisfaction when you treat patients. So when you relieve their pain, you get that much of satisfaction. Also have these tools like how to market yourself or to how to sell yourself.
Mm-hmm.
Then definitely see you're at the front end worker, and in the front end you meet so many different types of people, and you enjoy that practice.
Right. Sir, what are the different type of practices that a dentist can do?
Yeah. Did you hear about Rich Dad and Poor Dad?
Yes, I have.
It became more popular nowadays, and a lot of youngsters were doing it. So what Rich Dad says is you have to be an employee. There are four categories. One, employee. Second is self-employed, and third one is in a small or mid-size business, and the fourth one is in private limited, right? If you see in dental this thing, you can become an employee, you can work in any clinic, you can start your practice, become a solo practitioner.
What is solo practice?
See, solo practice is run by one dentist. That doesn't mean he doesn't have consultants. He will be having associates also, but
Mm-hmm.
the ownership is only on one this thing. And instead of saying it's a solo practice, we can say it's a doctor-based practice. So the patients are seeing who is practicing there, which doctor is practicing there. On his name, the patients are walking in, and then it is distributed to the associates.
What are the differences between an approach to open a clinic in tier 1 city and tier 2 cities?
Always after finishing the BDS, we have the dilemma whether we have to start in tier 1 or tier 2,
G.
what size of the clinic we have to
Yeah.
start, or which location we have to start,
Hmm.
and all. So, to address whether it's a tier 1 or tier 2, this
Okay.
thing, see, I strongly believe to have a very successful practice, you should sell yourself first
Hmm.
because you are in a service industry.
G.
This is not a product. Product can be described.
G.
In a service, it's all differs from individual to individual.
Okay.
So for the service, who is the front face? Person who is giving the service is the front face. So
Acha.
the here the doctor is the front face.
Okay.
So he has to sell himself first. For
Hmm.
that, he has to have soft skills.
Okay.
He should have an empathy towards the patients.
Acha.
These are all will create trust in the patient, and the
Acha.
patient comes and walks into the practice.
So basically, in solo practice, whoever dentist is there, he is the brand, right?
He is the brand. Like Lalita Jewelers, for taking example, he is the brand, right? So like for a solo or a doctor-based practice, doctor is the brand.
Okay.
They don't mind which clinic name it is. They say, okay, Dr. Kiran's practice. We'll go to Dr. Kiran. You go to Dr. Kiran if they want to refer. So coming to tier 1 and tier 2, when you have to build a community, right? So to become popular, it's very fast in tier 2 cities.
Okay.
Why? Because you have a close community there. Mouth to mouth propaganda is very fast. And you have so many of friends, relatives in tier 2 city. So you get more propaganda in the faster time. Coming to the city, it takes little more time. Unless you act in a movie or you do it, you become popular overnight. Otherwise, as a solo practitioner, doctor-based practitioner, it takes time. For that, there are some measures. Like if it's in a city or a tier 1 cities, you need to join clubs. You need to create a community.
So joining a club is a good option.
Yeah, definitely. Any social communities, maybe club, it can be for a cause, it can be marathon or any of it.
So any club that is there, they are potential customers for you.
Potential customers, see, I believe potential customers, I say like you build up a community which is going to stay for you for a longer time. When we say customer, they may come or may not come to you later after once they visit you. But when you develop a community, you have building a bond between them. So definitely they will stay with you for a longer time.
Okay. Sir, how to choose a location if I want to open a clinic?
Yes. See, whenever you think of choosing a location,
Hmm.
the first thing what we are doing dentistry, right?
Right.
So definitely it is above middle class and above middle class who can afford,
G.
or rich class.
Hmm.
So the major target for our clinic is middle class or above middle class or lower middle class. So I would suggest first you have to go to the upscale market.
What is upscale marketing?
What I mean by upscale market is the market where, suppose for you take it for example, in Hyderabad, you go to the area something as Raniganj,
Okay.
which is an market for industries and everything, or vegetable market. Those are all normal markets. And upscale markets where you have fashion brands,
Right.
where you have MNC brands which are going to display, malls. And for every city, you have an area where there is an upscale market, right? Where you have a good international brands which are showed off. So those are upscale markets. So you need to target for upscale market. And you should have a mixed type of population, like middle class, rich class, because always remember this, in that same community, many of them youngsters which they do a mistake is, okay, I'm going to start my practice in Jubilee Hills because there's a lot of rich class over there.
To the people that doesn't know, Jubilee Hills is considered to be a rich class.
Rich class in Hyderabad.
Yeah.
I can tell you only 10% in that community will come to you.
Okay.
Rest 90%, either they already have a dentist with them or they travel to Bombay or some other city to get the treatment done.
Right. Okay.
So always target for a community where there is a mixed population. That is one point. The second thing is visibility.
Okay.
Wherever you are seeing a location should have a good visibility. And third thing is it should have a popular location or some landmark beside you.
Okay.
In Orbit Mall, there's a mall which is there. So what's the advantage with that? So they say, okay, it's just near to the in orbit because every weekend I'm going there. So they don't feel the distance.
So you open a clinic near to the brand that is already there.
Already there or a popular location.
Okay.
So you can say like it's near Secretariat.
So like it should be relatable or something?
Regularly they are commuting, they'll feel that it's very nearby.
Okay, like D-Mart and all.
Like D-Mart or any shopping mall or theater or sometimes a statue, park.
Understood.
That is one of the. And third thing is when you come to tier 2 cities, this is for tier 1 which I am
Okay,
speaking
got
about.
it.
When you go to the tier 2 cities, if you see all the dentists or medical practitioners are in one street or in one area.
Okay.
Okay, then we'll get misled. So many people are practicing here. मेरे को कौन patient आएगा? So let's go out of that area and practice.
Hmm.
So that time what happens? Suppose you say X city,
Hmm.
X town, if you
Okay.
are thinking of practicing there.
Hmm.
What about the villages which are surrounding it? They only know that all the doctors are concentrated in this area. So you are
Right.
missing with that population there.
Okay.
So you will be concentrating only in that town, but you won't be getting clientage, but you will get clientage, but it will take time for them to know and come. But when you are practicing where everybody is practicing in that area, you will be like noticed faster.
Acha. Now we have chose a location to practice. Now should I rent a clinic or should I buy a clinic?
Yeah, it's a good question. It all depends on how much budget you are thinking of and how to position it. See, there are three aspects. First is you rent it. Second, you acquire it. Third is you invest.
Okay.
Renting. Suppose you rented a place. See, when you are going to that area, you are not well versed with that area, right? You're new to that area. So you want to know that whether that place is good or not. The first moment when you buy that place and afterwards you realize this is not the place, I would have gone at least 2-3 kilometers away from it and bought in another place, then it would have been good. So I always suggest this first you rent in that area.
Okay.
So when you want to exit, it is easy. You are not born to it, right? So second thing is once you are started your practice, after a year you thought that yes, this is the area which I have to practice.
Okay.
Then you think of acquiring it, buying the same place or just place near to buy to it, acquire it. Then you made a very good profits out of it. In the third phase, then start investing.
What do you mean by investing?
Investing is buying in some other place and again opening another branch. So the third phase comes as investment.
Okay, now I have acquired one or maybe rented one clinic. Should a dentist start with single chair or two chair or multiple chair setup?
See, my personal belief is every dentist should have two chairs.
Okay.
Why? Our dental treatments are lengthy treatments.
Right.
Sometimes there's an open surgery which you need to do to extract a tooth or something.
G.
It takes half an hour or 1 hour.
Right.
By the time a new patient walks in,
Mm-hmm.
and nowadays nobody wants to wait. They have less time. So the moment they come, Doctor Sahab khali hai kya? They want to see. If he sees me, then I am going to wait. Otherwise, I'll come tomorrow. The
Right.
tomorrow will be tomorrow only.
Tomorrow they won't come.
So two chairs, one chair will be working, the other one you can use as OP or for consultant who is coming.
Okay.
So basically, one dentist should have two chairs.
Okay.
Suppose you have a good practice and you also have an associate, means you are employing another 2-3 freshers, then each dentist should have two chairs. Then again, keeping in mind the ROI, we'll go in the reverse way. How many days you work in a month?
Like 25.
25?
Yeah.
So how many hours in a day?
8
Say
hours.
8
8
hours.
hours.
Per one patient, 1 hour is the average period you work. Suppose you think it like that. So 8 patients in a day,
Okay.
right? 8 into 25, it should be 200, right? So 200 patients in a month, if you are not seeing, then there's no point in going from second to third chair. Each dentist should have two chairs, but when you want to increase into third or fourth chair, you should see how much walk-ins are coming. So just like that, I have to expand my clinic to namesake to say it is a big clinic. Don't expand it into third or fourth chair. Go on calculations. See per hour you work on one patient. So two chairs. I'm not talking about two chairs. One chair. How many patients is going to accommodate? At least if you are crossing 100 patients or 120 patients in a month, new patients, which I'm saying, then you think of going for the fourth chair,
Hmm.
third or fourth chair. Even that is going to fulfill your OP is going to increase. I mean, the appointments which are obviously when you go for the third or fourth chairs,
Mm-hmm.
all the appointments are going to increase, right?
Right.
If the appointments are crossing more than 200, then you can expand into multiple chairs so that you won't do mistakes like how the older dentists or we used to do.
Okay. For a clinic with a two chair setup, how much should be the area of the clinic?
See, always if you go to the this thing, you need a reception,
Right.
which should be around minimum 200 SFT. Each chair will occupy 100, 80 to 100 SFT. So two chairs there, that's take 200 plus 200, 400.
Waiting area also.
Waiting area 200 plus two chairs 200. So 400 SFT. Rest another 200 you require for your lab toilets, or and then for the staff to relax. That is another 200, and 100 for your counseling room or MD room or whatever it is. So I can say two-chair clinic minimum, like
Or maybe moderate. It's
yeah, but when you go into tier one, it's difficult to get so much of space for feasible rent and a good location. Then you compromise within, like, chair will occupy not 100 SFT. You can minimize it to 70, 80 SFT also, and then do partitions. Instead of going for permanent walls, you'll be going for removable or adjustable partitions. And
okay. So around 900 to 1000 square feet is
no, I don't think 600 will be enough. 600 to 700 for two-chair clinic.
okay. Sir, how to acquire associates and when should we acquire?